In the next 10 minutes, I'm going to discuss the assassination of the UnitedHealthcare CEO and 5 key takeaways that we can use in our private practice that'll allow us to connect with our patients more, that'll allow us to tap into and to work through the frustration that many of our patients have with the healthcare system. DermBiz episode 27, let's get started. And so we are all aware of the assassination of Brian Thompson on December 4th, 2024, the CEO of UnitedHealthcare. He was assassinated in New York City. Brian Thompson is a fellow University of Iowa alumni. And so this was definitely a tragedy, and many people aren't seeing it that way. And, you're seeing a lot of conversation on social media, and many of it is very geared toward the negative. People are saying that he should have been assassinated. People are saying that more CEOs of healthcare companies need to be assassinated. And, I don't know where, as a viewer of this, how you stand on that. To me, I think that is very crass. I think that is very insensitive. I mean, this man has a husband. This man has kids. You may not agree with the practices of the healthcare company that he ran, but can we have a little bit of empathy for him? But with that being said, I want to take this situation and see what we can learn from it as private practice owners. And so I have 5 key takeaways, 5 key things that I think that will allow us to connect better with our patient base and also recognize the environment that we're living in and how do we provide the best possible care for our patients while building a rock solid financial business, because the business has to be able to take care of our staff and their families. So let's get into it. Number 1, this assassination of Brian Thompson and the public reaction has reminded me of the need to be more empathetic. People are hurting out there financially. There are people whose medical care has been denied, causing death. There's people who financially didn't get things covered that they thought would be covered, leading to bankruptcy. I know they say that bankruptcy, medical bills are the number 1 cause of bankruptcy in the U.S. Food costs are increasing. Wages aren't keeping up with inflation. It's so many different things going on right now. The cost of education is going up. It's so many different things going on right now, and people are feeling stretched. I believe that the assassination of Brian Thompson kind of brought all of those things to a head. It brought all of that frustration and anger to a head. And so if we as private practice owners, if you as the doctor or private practice manager, if you could be empathetic with that person who you're having a conversation with, that person in your exam room, that person at your front desk, that person on the phone, I think that it will allow this horrible situation to bring you closer to your patients. Number 2, do your best to set clear expectations. I think a lot of frustration comes from patients when they get a bill that they never expected. And that oftentimes is because they have an HR manager, they have an overzealous insurance agent, they have somebody in their lives telling them that this insurance plan that you have will do all of these things. And the things that they're saying that the insurance plan will do, the insurance plan doesn't do. The things that they say the insurance plan will pay for, the insurance plan isn't going to pay for. And the patient doesn't know that until 30, 60 days after their appointment. And so they get this bill in the mail and they're shocked and surprised. If you can set clear expectations by doing insurance verification checks, letting the patient know that they have a deductible, letting the patient know that they should expect a bill in the next 30 to 60 days, it will kind of lighten the blow once they get that bill, so they're not so shocked and surprised and frustrated. Number 3, as a private practice, do your best to diversify your revenue streams, meaning the more services that you can do that does not require the participation of an insurance company, the better. The more services that you can do where you get paid on the day of and you don't have to bill out a patient, the better. The more services that you can do that doesn't require you to get authorization from an insurance company. It doesn't require you to get authorization for medicines and all of these different things, the better. Because now It's a person-to-person conversation. If the patient doesn't want the thing done or is not willing to pay, they don't have to pay. They go home, no bill coming. If the patient does decide to go on with the service, they pay at that time. And as we all know as private practice owners, when a patient is out of network or when a patient is paying for a service that is non-medical, you have more flexibility in the price of things. You can actually give a discount, or you can do different things that will be win-win for both you and the patient. Whereas when you're dealing with insurance, your hands are kind of tied. Number 4, we are looking at doing more public outreach. By more public outreach, what we're talking about is more free skin screenings, more opportunities to get out into the community to provide our services free of charge, because it's an opportunity for us to get the care to people who otherwise don't have the insurance or don't have the finances to receive that care. This is our opportunity to give back. This is our opportunity to show our community and show our patients that this is just not a dollar and cents thing, that we actually do care about the public health, and we're willing to give the most valuable thing that we have, which is our time, to help build up that public health. And number 5 is to collect upfront. By collect upfront, what I'm talking about is you want to collect copays at the time of service. You want to collect balances when a patient comes in. I do collection calls each month for our practice, and what I found is that the majority of people who end up going to collections are people who we just failed as a practice to collect their copay. And so these are nominal, these are small amounts, but it wouldn't even have been an issue and got to the collection process, got to the point of collections, if we would have collected the balance at the time of service. And so again, the surprise bills are oftentimes what creates the anger in patients. They don't necessarily, it's not even necessarily that they don't want to pay, but they don't want to pay when they didn't think they had to pay. It may be their insurance agent, it may be their HR person, it may be somebody, whomever, or they may just misunderstand because insurance is very complicated, but they have been convinced that an appointment should be covered. And by covered, they think covered means they don't have to pay anything. And so the more that we can take that surprise element away by collecting at the time of service, by collecting copays before service, the better off that we can be as far as making sure that we're on the same page with the patient. Again, my heart goes out to Brian Thompson and his family for this tragic event. But us as private practice owners, us as managers, us as doctors, it is our responsibility to learn from this situation and see how we can better serve our communities. These 5 key takeaways that I discussed are what we're going to implement in our practice in the aftermath of this Brian Thompson assassination. And I hope that you recognize that this situation with Brian Thompson is giving us a clear vision of how people are feeling. And so let's respond accordingly. What other specific topics related to the business of private practice management would you like for us to cover? Please share in the comments below or reach out to us on social media or our email address, thedermbiz@gmail.com. Our mission is to create a movement of collaboration and support amongst physician-owned private practice owners. If you would like to join that movement, again, don't forget to like, share, comment, and please don't forget to subscribe.